So does it look like we could possibly be headed towards that same scenario that we did a couple of years ago when, deaths were occurring just about daily?
Tal, I just had this conversation with a patient earlier today, and she asked me, she said, Doc, I have COVID. My cousin has COVID, and one of my coworkers has COVID. She said, things are starting to get really bad again. And then she asked me, she said, do you think we're headed back to where we were? And what I told her was, we're not. It's not going to happen again, at least not right now, because things have changed. And what's changed is, number one, we now have been in this fight. We fought the fight. We won the fight. We beat it down because we developed tools. Now, some of these tools that we developed, number one, were the vaccines, and they work. And the patient that I spoke to today, she's been vaccinated and boosted. She had very mild to moderate symptoms. Her family member and her coworker, they had almost no symptoms at all. But on top of that, we now have medications. I prescribed Paxlovid. She's going to go pick it up. And the deal is, we have been in this fight. We have these tools, and I feel very confident we won't go back to where we were having people dying every single day.
So are symptoms with this new COVID, is it similar?
It is similar. It is very similar because it's still COVID. It's coronavirus. It's a new strain. It's more infectious. But the good news is there's a new booster coming out. The CDC is indicating it should be out in the next 3 to 4 weeks. And this new booster that's coming out is much more effective against this new strain of coronavirus. It's called the Eris. It's the EG5, and it's very infectious. But the good news is it's not much more virulent, meaning you have a higher chance of contracting it. But if you get it, you don't necessarily get more sick than the previous strains. And as I said before, we now have those weapons in our arsenal so that we can effectively fight it and get everybody well.
So do you recommend in that case, since you talk about the new booster, for people to get boosted now if it's available?
Well, here's what's being recommended by the CDC. If you're someone that's vulnerable, meaning that you're immunocompromised, you're someone that's elderly, you have chronic medical conditions, and you're not up to date on your boosters, go ahead and get boosted now. Now, the problem is you won't get the new booster because it's not available yet, but just get boosted because you're in a vulnerable situation and the virus infection rate is up right now, so you need all the protection you can get. And then what will happen is when the new booster comes out in the next 3 to 4 weeks, then it'll become available, and then you'll be advised on when you can get that additional booster. But the take home is, if you're someone that's healthy, it's okay to wait just because it's going to come out in about 3 to 4 more weeks. That way you can get the booster that's more effective when it comes out.
So then, Dr. Quinn, do you recommend masking again?
That's a good question. Now, what I advise my patients is, know your risk factors. If you're someone that's immunocompromised, you're elderly, you have chronic medical conditions, you're around a lot of different people, go ahead and mask up. If you're healthy, just use, if you're around different people, like going out in public, it's not a bad idea to wear a mask. But if you're healthy, you can be a little bit more reserved with that mask.
Got you. All right, we've run out of time, but thank you so much for your insight, Dr. Quinn.